My name is Katanna Davis, and I'm here with Bailee Bronson-Waters for the COVID-19 in Oklahoma Oral History Project. Bailee, if you wouldn't mind spelling your name for the record, please.
Hello, yes, I'm Bailee Bronson-Waters, Bailee, last name Bronson hyphen Waters.
Thank you. So I guess we'll just kind of dive on in. And do you want to give me an idea of like where in Oklahoma you live? I don't need an exact address or anything, but like the region you associate your life with.
Yes, I live in the smack dab in the middle of Oklahoma City.
Okay. That sounds like a pretty lively place to live. Um, so I know you work in a hospital. Do you want to talk about your position, what your job title is, and what you do a little bit there?
Sure, I'm a registered nurse at Mercy Hospital in Oklahoma City. I have ICU critical care experience, but right now I'm a procedural nurse in the interventional radiology department. So basically, interventional radiology nursing comprises of vascular care, anything like stroke intervention, blood clots in legs, lungs, which we've seen quite a bit with COVID patients, any type of biopsies, drain placements, anything that requires image guidance for patient care. That's what we do, and that's what I do as a nurse.
Oh, cool. How long have you been in this position within the hospital, or how long have you worked at this hospital?
Um, in but this month actually it'll be 6 years that I've worked at Mercy.
Wow.
But in various roles, I started as a pharmacy technician, and then a nurse's aide, and then a nurse extern, and then a RN. And in February, I'll have 3 years as the RN.
Oh, cool. So you've kind of seen the life in the hospital pre-COVID, during, and now we're not that COVID's over in any matter, but the after effects of the larger part of the pandemic.
Yes, absolutely.
And so I also understand that you're going to school right now as well. Do you want to talk about that a little bit? What you're going to
Yeah.
school for and
Yeah, so I'm in my nurse practitioner school. It's an online program at Herzing University. Um, and it basically is a mid-level program. So you have nurses, and then in the middle tier, in regards to authority, you have PAs or physician associates, and then nurse practitioners are at the same level, and then physicians are above. So it's a mid-level program, and then the specialization will be family care
oh,
in
great.
the primary care setting.
Do you intend to stay working in the Oklahoma City area?
Um, I would definitely be open to it. I'd be open to anything. My wife is also in the Oklahoma State history program, so we're kind of where we both find work. We'll be open to where we can both find work.
So I think I'm gonna jump into kind of COVID related questions now. So since you've kind of been, you've been there at the forefront of COVID, and I feel like, you know, um, health workers are some people who have experienced it, firsthand since the beginning. What were kind of your thoughts when this was first happening, and kind of how you felt, maybe personally, but also through work and like in your how it's affected your school life and stuff like that?
Um, so I would say, in the beginning, it was very, very frightening. It was all just kind of blind panic. We weren't sure what this was, let alone, is this for real? This sounds like it's just overseas. Well, crap, now it's here. um, and it was very alarming because we, especially working in IR, and my hospital specializes in strokes, and not all patients who are having a stroke will go to just any hospital. They send them to a certified comprehensive stroke center, like Mercy. And so, we learned the slogan, time is brain. Any amount of time that there's a stroke occurring, you lose brain matter. So time is brain. You need to get moving. And so when we were first introduced to COVID, it became very scary because now we're like, okay, time is brain. But what is this? Do they have this? What are we doing? So it was very scary. It was just alarming, and trying to put on a knowledgeable, positive face for patients and families, and trying to just kind of do your day-to-day tasks, carry those things out. um, I would say as a student, it's been very challenging, mental health wise. It's been very challenging. Thankfully, my program, everyone else, it's a healthcare program, everyone's in the same boat. So they've been very understanding and, hey, just holler if you need an extension, anything like that. We know what you're going through. So that's been very good. I would say my program requires clinical hours, and so it's been very hard finding anywhere who will take students, because to them that's just one more exposure opportunity. Whereas in my mind I'm like, okay, I'm trying to get out there, get my degree, and get out there and help.
Yeah.
But it's just been a lot of roadblocks. I know the world kind of went to a standstill. um, and I think that I definitely experienced that as well.
Yeah. Um, so do you think how you feel about COVID now in the pandemic has changed since when it first started or over time or
Can you repeat that?
oh yeah. Do your feelings towards the pandemic, I know you said you were like it was scary at first. I still think it's scary. And you're frightened. How do you feel maybe now? Have your feelings changed over time? Because we've been, going on how long of being in a pandemic?
Yeah. I would say the biggest piece of just peace and inner calmness has been this vaccine. I know it's a politicized type thing, which the flu vaccine, the polio vaccine, the hepatitis vaccine, those aren't politicized. So as a healthcare practitioner, it's important to me to educate, and advocate that people get vaccinated, because we live in a world we're always fighting against each other, where um we have a tool now that we didn't have when thousands of people per day were falling off the earth. But we have this tool now. Um, and so I think it's important that we use it. And I would say that, I still try to mask wherever we go, because, the contact rate is not zero, even though, your protection level certainly increases when you have the vaccine. But I would say, from when it began to now, I would say that I have, more of a comfort level knowing that we're vaccinated, but still trying to protect others. Um, so I don't think life will ever be the same.
Yeah. Um, so with your job, other than maybe, how you perform and how you interact with people, has COVID affected you personally in your job or maybe in what ways? Maybe how you see your job and the people around you and
Yeah, I would definitely say so. I think even just, before this interview, I was at Costco, something a totally normal thing day to day. and I, have this thing in my head, well, so and so is not wearing a mask.
Yeah.
Well, and it's the same thing at work. You run into people outside of work, who from there, and you're like, really? You're not wearing a mask? And so it just it's kind of like you try not to judge, and you try not to, you know, this might not be right for this family, but it's right for this family type of thing. Um, so in regards to the people that, that I work with, that would be a thing that I think we all are kind of struggling with. And even in COVID too, we were like, did you really decide to go, out of the country? Like kind of being a little, but you can't do that because you'll drive yourself crazy. But I think that it's definitely impacted the way that we deal with patients. Now we have to have, before we do certain procedures, have to have a negative COVID test, things of that nature for sure.
Yeah. Have you noticed maybe um, in your community, the people you hang around with, your work community, or just maybe Oklahoma City area in general, like how people have people like change their opinions, evolved over time, kind of like their response to the pandemic? How would you maybe interpret those?
I think my response to that would be, if you don't think that the virus is real, take a walk in the COVID unit.
Yeah.
That would be my response. I would say, I think that I'm sorry, can you say the question one more time? I was going down a rabbit hole.
Yeah, just kind of maybe how you've seen uh, COVID and its lingering effects, like how it's affected communities around you, maybe like the greater OKC area or your work or the people you are normally around, or
Okay, so lingering effects of the pandemic. So I would say, at my hospital, the COVID numbers have certainly gone down. Now, the people who are there, who have survived COVID, have been there in a hospital bed like a month, for about a month or more, and they're calling it COVID recovered. Well,
hmm,
they're calling it COVID recovered because they have exceeded the amount of time that they're contagious, and they've survived, but they haven't recovered. Nothing about them will be the same. There's people I think we're probably pretty close in age. Um, there's people our age, a little bit older, a little bit younger, who didn't get the vaccine and now, have feeding tubes for their whole life.
wow.
Who now, have a airway in their neck for their whole life, who are just never going to be the same. So I feel like the numbers on paper, it looks better,
Mhm.
absolutely, but these people aren't improved or recovered COVID patients. Um, I would say that we've all noticed, economically, huge differences, and prices of certain things, and shipping time of certain things. Um, it's just, I think there's a life AC and BC, you know, after COVID, before COVID.
Yeah.
So I think that's evident with everyone who has been paying attention and been
Mhm.
taking it seriously. If you choose to live in oblivion, then that's your choice. But
Yeah. So I guess we've kind of talked a little bit about physical health and like the effects you're seeing. So how would you say that COVID is affecting people's mental health, maybe your own, people around you, people you know? Because I'm sure COVID has had some pretty heavy effects on that as well.
Yeah, absolutely. I think everyone, even if, you don't, even if you're not, as into masking and vaccinating, I'm sure it has effects on other people, um, because of the inconvenience that it, you know, poses in everywhere, in restaurants, everywhere. I will say that at the beginning of COVID, um, there were a few of us nurses who actually talked with each other about, do we need to rent a house? Because we don't know, like, do we need to just rent a house? And that's what a lot of physicians and nurses did, especially who were in the ICU at that point, in the emergency room. Um, you know, there was there were several physicians at my hospital who, moved away from their families because they didn't know what this would do to their kids, what this would do to their spouses, and they're, you know, elbow deep in the virus. So that was a serious talk that, I'd had with my family, and, what does this need to look like? Um, I would say that COVID certainly increased my anxiety and my questioning of people, um, because I feel like as healthcare workers, the majority of us are like, just, just, just do the right thing. You're not seeing what we see. Um, it's just not good. These people go from, I literally can recall a patient who, um, one day he was literally having full conversations with me, and the next day they were gone.
Wow.
I mean, it's just, and I had just left the intensive care unit when COVID started. So I think God had a hand on me for that one, because I don't think I could have handled it with school.
Yeah.
Um, so I think that, emotionally it's been a train wreck for everyone. I really do. And we need to be more sympathetic and empathetic towards people and be your brother's keeper.
Yeah. Um, so how would you say, maybe like leaders in your area, like government, maybe local to the Oklahoma City area, but also maybe to the just Oklahoma in general, have responded to COVID-19 and the outbreak, and maybe what are your thoughts on that?
So I am a member of the LGBTQ community. And I would say that, I identify that as my sub community within Oklahoma.
Mhm.
I think that the LGBTQ community has been, very strong and very, um, pandemic minded in the way that they handle events. The Pride festivities have been altered to do so safely and carry those events out safely. I would say that, you know, most most everyone who lives in Oklahoma City, and especially in the younger populated areas, um, take it seriously, and that's kind of who we identify with in the businesses we support. I would say as a state, our governor is gravely mistreated this pandemic. I would say that as a healthcare worker, it's felt like a big slap in the face that it took so long to declare a state of emergency, because then we're not able to attain those federal resources that were so desperately needed. Um, I think that, you know, if our governor, Kevin Stitt, were to maybe take a walk around the COVID unit, maybe not. His thoughts might be different.
Um, so um, like, how do you see, like, maybe with just within your job and then within your personal life, COVID in the future? Because I mean, it's still we still have, cases, and there are still people that are going to be, like you said, be affected by it. There's still people that are having, feeding tubes and can't breathe on their own. So what do you think maybe some long-term effects of this might be?
As a society, I think there will be more division than anything, which is unfortunately, I don't think what we need. But um, certain people uh, disagreeing with whatever the other person is doing. I would say until this vaccine, which is to me the tool and the light at the end of this tunnel, until it is, less politicized, I think we're going to see long-term effects of this virus because people aren't going to get the vaccine. It's not a priority. There's lack of education about vaccines in general. Requiring vaccines to go to work and go to school is not a new phenomenon. As a healthcare worker, we have to have the flu vaccine every year, period, unless you have a religious exemption, which is the exception and not the rule. You have to have your 4-year-old vaccines to go to kindergarten. It's just not new. I think the only difference here is that we've been so divided politically the last few years that this was a big test in humanity, and I think we failed utterly.
Yeah. So maybe on a little lighter note, what are some ways you've like had fun during the pandemic, since people, are self-isolating and, just kind of generally distancing themselves from other people? Maybe what are some ways that you stayed, I don't know, on a friendlier note and maybe interacted with people or like kept your time, even though you're obviously busy with work and school?
I would say a huge thing that I've done in this pandemic, that's really not for anything but just a fun outlet for me, has been blogging. Um, I, there for a while we were having to reuse our masks for days and days and weeks on end, and reuse our N95s. So we weren't allowed to wear any makeup, anything of that effect. Um, but, I wouldn't wear face makeup, and my hair had to be covered, face had to be covered, everything had to be covered because, we're caring for these people with this black plague that we don't know what it is, and, this, that, and the other. My patients got to know me from here. Hi, I'm Bailee. I'm going to be your nurse. I'm going to be responsible for your life. How impersonal. So what I started doing, and I think for my own sanity, as I started doing eye makeup, and when we were finally allowed to start, getting a new N95 at the end of the day, a new mask at the end of the day, and not having to ration them so much, I started wearing full face makeup. And that's just been a huge outlet for me. And, my patients are, oh, look at your fun eyes. Oh, look at that. And I feel more myself, when you outwardly are able to express yourself, you feel more yourself. And so I think that's been a really positive thing for me. And just saying you love people, and being kind to everyone that you have the opportunity to, because you just don't. I think this has also highlighted the unpredictability of life and the finiteness of life. Just calling your family, calling your friends, complimenting people, even if it's somebody that you see all the time. I can't remember your name, but you look great today.
Yeah.
Just be kind to people. because there's not enough of it. Yeah, that's
So I'd
a
like to talk about your blog a little more then. When did you start doing this? What time, like during COVID time, did you start doing this? And do you still keep up with it?
Yeah, so my blog is an Instagram-based blog. It's called Joyful Bee OKC. My family and friends call me Bee, and I'm from OKC. um, it I started this blog, I want to say this last May. And it's, I mean, not by any means got a huge following, but it's, my little family, friends of their friends, and, just a little community of people um, who enjoy what I put out there, who have been feeling the same types of things. Um, and it's based very much around mental health. I speak very openly about, you know, my struggles with mental health, um, trying to normalize it and do my part to take away the stigma, not only as a person who, is atypical in society, being a gay woman, being a plus size woman, but also as a healthcare worker. I feel like it's my responsibility to, educate, to make people realize that, you're not crazy. Everyone feels this. But to not like, you know, push it aside. Like everyone feels this, don't worry, but
Mm.
you matter. What you're feeling matters. This is important. And I also, take pictures embracing my body in clothes that I love, that, I've spent so long not wearing because, I didn't like how I looked. Um, and really it's just about self-expression and kindness, shopping local, things of that nature.
Cool. Do you think you would have maybe started this blog without COVID happening, or do you think this is just a fruit of COVID's terrible loops?
Yeah, terrible dreams. That's a good way to put it. I really can't say. I don't think I would have. I really don't. I think it just, you know, this
Mhm.
is what really got me. And I can't imagine, if you think about anytime you've been in the hospital for anything serious, you remember the people who are involved. You remember, you know, you remember. And, I wanted to show people who I am and who's taking care of their mom, their loved one. Um, Sorry. Whew. You
That's
know,
okay.
you you're taking care of people when they're terrified, when they're out of their element. And that's humbling. It really is. It's easy to get, oh, we gotta keep up. We're busy today. We got all these cases, da da da. Let's keep it going. But when you take a step back, you are being entrusted with someone's, treasure. You really are. And I don't take it lightly. And I think that having healthcare as a human experience and showing people who you are and asking about them. Where'd you drive in from today? Oh, did your grandkids dress up for Halloween? Having this as a human experience takes away the business of healthcare and makes it a personal experience.
Um, so earlier you kind of talked about maybe like the way COVID has been politicized and um, has kind of created this division. Have you noticed maybe people as COVID goes forward or is going forward, maybe they switch from their like one point of view to another? Have you seen a lot of that, or have you seen a lot of static, um, maybe within the larger like your job or the OKC area? Or
Yeah, I would say that it kind of really just depends. I've seen both. I've seen, there's someone that comes right to mind, that I know who their opinion is, masks are ridiculous, the vaccine requirement is ridiculous, and after all this and working in healthcare, it's still ridiculous. And I can't understand that point of view, but I do respect that person. But I will say that the people who have changed, who maybe started off that way and are now, heartfelt and um, being their brother's keeper, have probably lost someone. Um, I think of an experience that I have at my job, keeping names and everything like that out of it. There's a map right by where I work, and I usually find like some stragglers standing in front of this map, and I'm like, oh, they're probably lost. They're looking at the map. And I asked this person, I said, hi, can I help you find something? And he said, oh yeah, ICU room, whatever. And the room number that he said I knew was in the COVID unit. Um, and I, walked him over that way, and he was just eyes huge, stoic. And I said, you're going to visit somebody? And he said, they just called me and said to get up here, that my wife's about to die from it.
Oh, wow.
Um, and so, you know, I don't know that person's experience or anything else, but I myself know several people who've died from COVID, not close family or friends, but it's a network, and we all have been affected by it and touched by it in some way. And I would say that the people who have changed have probably experienced that, because it's hard to understand unless it's happened to you.
Um, so I know that another part of the pandemic was employment was affected heavily. And I guess, on the news and stuff you see, they always need more healthcare workers, from the pandemic. So were jobs within the healthcare field, I don't know, because you see like people closing restaurants and closing stores, and you can't really close a hospital. Um, so did you see a change maybe in employment and like how many people would be working or doing specific jobs in the hospital or?
Yeah, absolutely. I would say that there was a several month period, at least a 3-month period, where there were layoffs. People who have spent their, most a better part of their career working in my hospital, were cut. People lost their health care. People lost, you know, if they had a sick spouse who was covered on their insurance, it was lost. Um, I saw that, and there were a few people who were furloughed in my department. Luckily, and as bad as this sounds, I think that my department brings in a lot of revenue because we are a stroke center, and we do a lot of strokes, and that's one of the main, I don't want to say attractions, but one of the main money makers for the hospital, and that's my department. So I think that in a way, I hate this, but corporate greed probably saved my job, to be honest. Um, but I did see quite a few people, who were let go. And at one point in my department, we were talking about, there was a real possibility that certain people would be cut, and oh, is it the newest people who are going to get cut first, or if we all put together our paid time off, could we save one staff member? We were seriously talking about these things. Um, I had a serious conversation with my wife and said, we need a backup plan because this might happen. People are losing their jobs. So um, I think healthcare, this is another example of healthcare being very top heavy. Plenty of administrators, plenty of people to tell people to tell people to tell people what to do, but not enough people to take care of patients. So I think that, you know, revising healthcare as a structure is a whole other bag of worms, but can of worms, bag of worms,
Can of worms.
can of whole other can of worms. But you know, I think that certainly played into effect.
Yeah. Because media doesn't really show. They show, walkouts and healthcare workers demanding more, but it doesn't really show the side of like these are people who are losing their jobs as well. What would you say maybe has been your take from media's coverage of COVID? Maybe from what you personally watch or just have seen other people lingering to, or because I know COVID or I know media has played a big role in the way that people have interpreted the COVID pandemic.
Absolutely. I think there for a while, there for a good while, they were playing, doctors who were in the bunny suits and had the all the PPE on and had a picture of themselves like taped to their gown right here, so that their patients could see what they look like. And they were, warning the masses and, this is real, we're here, we're fighting this. And I think that as humans, we need that visual, effect, because like even just think of the word genocide, like, okay, that sounds bad. I mean, but unless you're there and you see it and you experience it, you have no idea what it's like. So I think that in a way, there for a while, the media did a good job covering what was happening, but I think that we got tired of hearing. We got tired of hearing about it. Everyone did, of course. It's drags on and on and on, and is stressful and overwhelming. But it's still present. It's still part of today's life, and I think that obviously there's slanting in the news medias and everything like that, but I think that the numbers that were put out every day, when I actually had COVID, my wife and I had COVID almost a year ago actually, and we actually had to turn off our news outlets because we were just quarantining in this house. And 1,200 people died today. Oh, this many people died today before any vaccine was available. And so I think it was terrifying as well, for sure.
Yeah. Well, thank you so much for agreeing to be here with me today. Are there any questions or anything you want to talk about that I didn't ask or include?
I don't think so. I think just thank you for your time and for this opportunity.
Oh, well, thank
I
you.
wish you good luck.
I guess maybe a little bit in on like, I feel like mental health and being true to yourself during this pandemic when a lot of things are up in the air was kind of what you're going on here. So maybe what's one like word of advice you would say to somebody who's struggling with mental health and their life during the pandemic or even in general?
Yeah, I think that just know that you're not alone, that you're loved, that you're valued, you're important, and there are resources. You have a community out there, even if you haven't found them yet. And what you're going through is valid. You're not crazy. And you're perfect just how you are. And the world would not be a better place without you.
Well, thank you for that. Yeah, so this is my interview with Bailee Bronson-Waters. Okay.